Trina, and I am the office manager at Family Chiropractic and Wellness. And this month of November, we will be focusing on motor vehicle collisions. And I just wanted to give you guys a little bit of information of what we do here. We have 2 chiropractors and 2 massage therapists that work hand in hand to make sure you guys go back to pre-injury status, and a wonderful staff that will be here to support you guys through a stressful time and be able to help you out. And if you have been in and out of collision, please let us know that we're here to help.
Hi, my name's Emily. I'm here at Family Chiropractic and Wellness. I'm the receptionist here, so I'm the first person you see as you walk through the door. If you've ever been in an auto collision, we take care of that here. I want to be able to make it as least stressful and easy as possible. Schedule the appointments, insurance, all the paperwork, get you set up with our doctors, so that you don't have to worry about it. So come in and see us.
Hi, I'm Dr. Reynolds, and I want to talk today about the exam and the history we perform after someone's been in a motor vehicle collision injury. So what we want to do first is get a great understanding of what's gone on during the collision and what injuries were sustained, as well as what's happened since the collision until the time we see the patient. With that history, we can add also to it the examination, and we do a full evaluation neurologically, we do it orthopedics, we also do a chiropractic evaluation, and order radiographic films. That gives us a full understanding of what needs to be included in the treatment plan, and we can help the patient get back to pre-injury status as soon as possible.
Hi, I'm Dr. Caleb here at Family Chiropractic and Wellness. One of my jobs here as a chiropractor is to develop a care plan. This care plan is designed to get you back to pre-injury status as fast as possible. How we do that is through chiropractic care, massage therapy, and other healing modalities such as cold laser, flexion distraction, etc. We do develop these care plans specifically to your case, so come on in, let us take care of you. We'd love to see you.
Hi, my name is Julie Weber. I'm a massage therapist here at Family Chiropractic and Wellness. Massage is very helpful to and complementary to chiropractic care. Most people do not know when to come in or if they should come in and get any help. If you notice after a few days and after a few weeks, usually you'll notice pain start setting in, stress starts setting in, usually in your cervical spine, anterior or posterior, and your traps, at that area, your upper shoulders. And you'll also notice it in your low back sometimes. Massage actually helps very much with managing your swelling and your edema that usually happens during those kind of traumatic stresses. It helps to loosen the muscles and the attachments so that your adjustments and your muscles will hold your body in the way it should, and bring your body back to its original state.
Hi, this is Erica, one of the massage therapists at Family Chiropractic and Wellness. For the month of November, we're going to be focusing on motor vehicle. As one of the massage therapists here, I'd like to go over why it's important to get a massage after an accident. During the accident, when your body is jolted suddenly, your muscles go into a protection mode, which is muscle guarding. And after an accident, you can experience a lot of pain, such as whiplash and trigger points in your muscle. One of my specialties here is working on your fascia, which is the connective tissue around your muscle. If we're able to release and relax your fascia, we're able to get to your muscles easier and release some of those trigger points and lengthen some of the shortened muscles that go into trauma mode after an accident. So if you have been in an accident, we'd love to see you here and take care of you.